If you're promising universal health care with only billionaires paying for it, it's just the same as Trump saying Mexico is going to pay for the wall. It ain't going to happen. Free health care. How do you feel about free health care?
It sounds great,
Yeah.
but in reality, it's not any government involvement in healthcare. What's it done? It's just driven the costs up.
Okay, so you wouldn't vote for somebody promising free health care?
No,
Okay.
because where's that money going to come from?
So you have health care through work.
I do.
Do you pay?
Yes, I do.
You pay. So the promise that the Democrats, socialists are making, they put out a document recently, but one of the promises is we're going to create universal health care. It's Medicare for all, and there will be no deductibles, no copays, no cost out of pocket to you. So the government's just going to take care of it.
Yeah, my question is, though, where my ability to free think comes into it. How much are my taxes going to go up to fund that?
Well, they're going to fund it with taxing billionaires. Corporations and billionaires, all those bad people that you just described.
It sounds great, but when those people run out, it's going to be trickle down. Once you're going to have to find the money from somewhere.
All right. So conceptually, you think that there's not enough money in the billionaires to fund this.
And I mean, we've offline we've discussed the numbers.
Yeah.
If you tax the bill, I forget what the exact rate that you said that they wanted to tax these billionaires at. With the amount of money that would translate from that, it would not be nearly enough.
Well, so if and it's hard to predict everything in economies because once you change something, the future changes.
Right.
Okay. But if we take right now, there's about 70 million Americans on Medicare. Medicare, Social Security.
Allegedly, there has been a lot of fraud being pointed out.
There are about 160 million Americans who are getting their health care through work. Still the largest number. I can't remember how many Americans, but there's also a group that are getting subsidized through the Affordable Care Act marketplace. And then there's some Medicaid. Medicaid is kind of like the welfare, if you will, of healthcare. It's for people with no financial means. And then there's a fairly small percentage, if you will, of people that are uninsured. They don't have anything. So if I asked for all those people that are currently uninsured, how much would it cost to give them Medicare? The way Medicare is now, which, by the way, there are deductibles and you have to pay for supplemental and things like that. So it's not totally free, not what they're promising, but it's Medicare. It's a big help. And, the number comes back about $500-600 billion a year is what would be needed to give them. If we taxed the billionaire's income at 100%, we'd have enough money to pay for that. So you would have to tax billionaire income, give them an income tax of 100%. So for every dollar they make, we take. That would pay for that. Now, two things, okay? Billionaires and trillionaire, their net worth is not tied up in their income, okay? The high, especially the higher up you go, they have equity. They have assets that define their net worth. Elon Musk, it's in ownership of his companies. Okay, so that's when they start talking about the wealth tax. So we're going to tax you based on how much your net worth is, not what your income is, so that you can no longer avoid paying taxes to your fair share. That's the argument. So on the other side of it, the equation, if you adopt a policy of Medicare for all, what do you think is going to happen to health care provided by employers?
Well,
it's going to go away.
Yeah, I guess, yeah.
Okay, so if the government says we're going to provide health care to everybody who doesn't already have it, no law requires companies to give you health care.
Yeah.
So what's happened in other countries is most of the workforce and things would lose their health care. Okay, so over time, you would no longer have health care, and they'd say, but it doesn't matter. You just go on the Medicare for all. But the higher ups, the people that they value more, that they can't afford to have them sick, because this universal health care is going to result in longer wait times, rationing. It always does. Okay. So the elites, if you will, in business, the people that the corporation doesn't want to miss work for extended periods of time, they're going to have private health coverage. So let's assume over time we get to a point where 75% of the people currently employed, paid for by their employer, would lose that, because it would just happen. How much then? The number comes about $1.8 trillion a year. Okay, current Medicare spending is, I don't know, it might be Medicare and Social Security, but it's like 1.2 trillion, so it more than doubled it. Now, at that rate, in order to fund that just with billionaires and a wealth tax, you would have to tax their wealth currently at about 25%, 25%.
And that's of their net worth.
Just of their net worth. So that would mean Elon Musk would, say he has $1 trillion, he'd have to pay $250 billion. That means he would have to sell his stock in order to come up with that money. So he would no longer be worth $1 trillion, he'd only be worth $750 billion in year 2. Mm-hmm. Take another 25%. Take another 25%.
It's basically they're just bleeding them dry.
So pretty soon there's no money left. Mm-hmm. Okay. Not only that, Elon Musk is no longer, why would he work? He's going to take, whatever money he can. First of all, he'd leave the country. Mm-hmm. There's nothing, you can't force people to stay. So he would take steps, he would leave his companies. And so how many people does Tesla employ? What's the economic impact of a Tesla and a SpaceX on the country? So, in the case of an Elon Musk, you lose all that. Mm-hmm. So, but the point is, it's unsustainable. Yeah. In a matter of 5 years, you take every billionaire would disappear. Mm-hmm. There would be none left. Mm-hmm. So now how do you pay for it?
The next level now.
The next level. Remember when Donald Trump said, we're going to build a wall and Mexico's going to pay for it?
Yeah.
I don't know who believed that. I mean, to me, it was campaign rhetoric. It was, you remember I said feelings? Mm-hmm. So you had Democrats challenging, well, how's he going to pay for this? How's he going to pay for this? He basically neutralized that by saying Mexico is going to pay for it, even though it was sort of a tongue-in-cheek. Some people, I guess, believed it. Right? That's the promise here. If you're promising universal health care with only billionaires paying for it, it's just the same as Trump saying Mexico is going to pay for the wall. Mm-hmm. It ain't going to happen.
No.
Okay, so the taxes are going to come out. You're going to pay for it. The workers are going to pay for it.